Hello, everybody, and welcome to the Kirby Institute seminar series. For anybody who doesn't know me, my name is Andrew Grulich, and I head the HIV Epidemiology and Prevention program here at the Kirby. I'd like to begin by acknowledging the traditional custodians of the lands on which we gather today. I'm on the land of the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging, and I'd like to extend that respect to any Aboriginal and Torres Strait Islander who may be presenting today. So some housekeeping to start off with. The format of the seminar will start off with the presentation, and that will be followed at the end by a Q&A. You can interact by typing your questions through the talk. So to ask a question, click on the icon with the speech bubble and question mark in the top right-hand corner to open the Q&A chat screen. When you click on Ask a Question, remember to write your name, and that will help us reference your question and make answering easier. You can upvote any questions you'd like to be answered. In other words, if you like a question, just upvote it and then it will appear on the top of the list for me. You can also change the order of the questions by clicking on the tab on the top right of the Q&A chat, which says most recent, and changing it to most liked. Okay, with that, I would like to introduce our speaker today, who is Ms. Rena Janamnuaysook, who's the Program Manager, Transgender Health at the Institute of HIV Research and Innovation, Bangkok, in Thailand. Rena is a transgender woman advocate. She works as a Program Manager for Transgender Health at the Institute of HIV Research and Innovation, known as IHRI, in Bangkok, Thailand, where she established the Tangerine Community Health Clinic as the first transgender-led health clinic in the region. She manages and provides technical assistance for the development and implementation of HIV and AIDS research and programs for transgender populations, ensuring effective systems and processes are in place to support high-quality research and programs to advance the work of IHRI in serving vulnerable populations. Rena's previous roles include Project Management Specialist in HIV Key Population for the United States Agency for International Development, Regional Development, Mission for Asia. In addition, Rena co-founded the Thai Transgender Alliance, the first transgender-owned human rights organisation in Thailand. She received a master's degree in international development from the University of Birmingham in the United Kingdom. And for those of you who have been to many international AIDS conferences in the last year or so, you will have seen Rena present, and she's been a terrific advocate for transgender research. And I think it's wonderful to have her present here at the Kirby. If COVID has brought us anything positive at all, it's to open up the possibility to have international speakers such as Rena talking to us here at the Kirby. So Rena, we look forward to your presentation, and over to you now.
Thank you very much, Professor Andrew, for the introduction and for giving me the opportunity to present today. And it's my great pleasure to be part of this seminar for the Kirby Institute. And I would like to take this opportunity to thank Dr. Benjamin Bovington for inviting and Ellen Lee and Rata Joseph for their technical support. And my presentation today will be focusing on transgender health and HIV, which is going to be learning from the 5-year implementation of the Tangerine Community Health Clinic based in Bangkok, Thailand. And greetings to all the audience and ladies and gentlemen. So before I start with my presentation, I would like to introduce a little bit about my organizations, Institute of HIV Research and Innovation. We actually growing out from the prevention department at the Thai Red Cross AIDS Research Center, and our primary focus is still the same, which including key population-led health services, PrEP, same-day ART, transgender health, and AQ HIV and KIO cohort, which is merging the Southeast Asia research collaboration on HIV, or as you know, as SEARCH as well. And these slides showing you the size estimation, the population size estimation of the transgender people in our region, which is Asia and the Pacific countries. So it was estimated by the Asia Pacific Transgender Network that there were around 10 million of the transgender people living in our region. And as you know that transgender individuals, they're experiencing multiple marginalized identities, is also including family rejection and domestic violence. We also experience bullying in school, and it was resulted in lacking of education. Many transgender individuals, they're facing physical and sexual violence. We also having the problem of unequal employment opportunities, as well as institutionalized stigma and discrimination. In terms of health disparity, we have very limited access to safe hormone use and other gender-affirming surgery. HIV and other sexually transmitted infections remain a great concern and a challenge in our region. Mental health and substance use is also alarming in my country. And I believe that is also a barrier to access to these services in your country as well. So in terms of hormone treatment, we, according to the data by the Transgender Europe Council, hormone treatment without medical supervision have been practiced in 39 countries and territories in Asia and the Pacific countries, and especially in my region, Southeast Asia, and it's also practicing in Australia, New Zealand, and also in other Pacific countries. In terms of the global HIV situation, transgender people, they were 49 times more likely to be acquiring HIV when comparing with other general and other key populations. We can see that the high HIV prevalence was observed in certain cities and geographic locations in Asia and the Pacific countries. So in this slide, it was the data generated by the UNAIDS, Asia and the Pacific. We can see the high HIV prevalence was observed in Jakarta of Indonesia, in Kuala Lumpur of Malaysia, and in Bangkok of Thailand, and as well as in the Philippines. Similar to other STIs, sexually transmitted infections, and hepatitis B, we still seeing the high prevalence of STI and hepatitis among the transgender people in many countries in our regions. Gonorrhea, chlamydia, hepatitis B were observed in Laos, PDR, Indonesia, and Papua New Guinea. Now, I'd like to bring you to Thailand, my home country. So as you might have perceived that Thailand is paradise of LGBT, I think in my point of view and in my personal experience is actually not true. So stigma and discrimination in healthcare setting remains a barrier, and it prevents transgender people access to the healthcare services for transgender people. A study conducted across the country from the transgender respondent in a survey showed the data that almost half of the transgender respondents never received advice and counseling from healthcare providers on gender-affirming care and hormone use. And almost half of the transgender people, they reported having negative experience from healthcare providers. And another study showed that 15% of healthcare workers, they thought that HIV positive transgender women should be ashamed and blamed. So it was actually from gender, based on gender identity and HIV status. So this slide shows you the population size estimation of the transgender women in Thailand. The data was actually obtained from the Ministry of Public Health. It was estimated that there were around 300,000 of the transgender women living in the country. We actually have around 70 million of the general population in the country. Of those 300,000, 62,000 of them, they were sexually active. And among those who were sexually active, 13,000 of them, they're transgender women who were at high risk of HIV acquisition. And the HIV prevalence in Thailand in 2018 was around 17% among the transgender women. So back 5 years ago, we at the Thai Red Cross AIDS Research Center, we thought that we should do something to serve to these vulnerable populations. So we with the support from the United States Agency for the International Development, or USAID, and we also receiving the support from PEPFAR, we actually organized the first national transgender community consultation in Thailand. We invited transgender representatives across the country. Transgender representatives, they came from many diverse backgrounds. They represented transgender sex worker, transgender living with HIV, transgender youth, transgender students, transgender men, and transgender celebrities. They came together and we asked them what kind of health services in their dream, whether or not they wanted to have their own clinic, how about the stigma-free environment, what kind of gender-sensitive healthcare providers should look like. So I think that meeting was very important and historic for us to move forward with setting up a transgender health clinic in Thailand. So, and based on that community consultation in September 2015, we mutually agree with the needs of having a transgender specific health clinic in Bangkok. We came up with the name of the clinic as the Tangerine. Tangerine was nominated and it was mutually and finally agreed upon by the transgender community. We have developed a slogan. We came up with the comprehensive health service package for transgender people. So I want to emphasize the importance of the transgender community consultation as the first key step to promote meaningful participation of the key population that you are working with. So apart from the community consultation, we also operationalized and adapted global and regional transgender health guidelines and protocols into the Thai context. So we actually adapted from the standard of care, which is developed by the World's Professional Association for Transgender Health, as well as several guidelines, especially the guideline for the primary and gender-affirming care for trans people, which is developed by the UCSF primarily, and apart from that, we also learned from the European guidelines as well, and we adapted to be more suitable and well tailored to the Thai context. And before we opened the clinic, we also conducted essential trainings for healthcare providers. So it became the mandatory training that healthcare providers at the clinic have to pass the gender sensitization training for frontline and healthcare staff. We also developed our own database and data collection form and unique identification codes for transgender patients at the clinic. We also provided the clinical training, which is including gender-affirming hormone treatment, and risk reduction counseling and other HIV clinical services for our healthcare providers as well. So here are the list of the comprehensive health service package for transgender women, which we have developed based on the transgender community consultation back in 2015. You can see on your left-hand side, it's about hormone-related services. We actually using these hormone-related services as an entry point services to generate demand and to bring to attention among the transgender community. So the hormone-related services include counseling on gender transition, hormone prescription, and hormone level monitoring, which has become a popular services right now at the Tangerine Clinic. And on your right-hand side, you can see that when introducing the hormone-related services, we are able to bring transgender clients to come to use the sexual health services in the same time. Sexual health services also include HIV testing, STI screening and treatment. We also provide condoms and lubricants. We have also specific transgender specific healthcare, which include anal and neovaginal pap smears, high resolution anoscopy and neovaginoscopy. We also dispense PrEP and PEP as well. And those who are tested HIV positive, we can offer the same day ART on the same day of the diagnosis if they are eligible. We also offer STI treatment, vaccination for hepatitis A, B, and HPV. And for those transgender women who have undergone genital surgery, we are able to offer the neovagina care as well. And at the below column, it's about the mental well-being services. We also offering mental health support and referrals. For those who are who wish to have gender-affirming surgery, we have the referral system and can refer our clients to have the counseling and the surgery at the Chulalongkorn universities at the Department of the Surgery, where we establish the referral linkages with them. And for the transgender clients who experience or who are the victim of the gender-based and sexual violence, we can refer them to seek the legal assistance at the Thai Transgender Alliance, which is the transgender-led human rights-based organization. So our health services is very comprehensive, and it was actually came from the transgender community consultation. So this is how the Tangerine Clinic looks like. And so the Tangerine Clinic is actually transgender-led. It's actually led by the transgender staff. So 90% of the healthcare team are transgender identified people. And we actually integrate gender affirming hormone treatment into the sexual health services. So in this picture is the winner of the Miss International Queen, and she actually represents Thailand, and Miss International Queen is actually the largest transgender beauty pageant in the world and is organized in Thailand in 2015. And she came to use the services at the Tangerine Clinic that time. And here are the performance to date. The data was updated as of March this year. So we actually serving more than 3,000 of the 3,500 of the transgender clients with more than 10,000 of the clinical visits to the transgender clients. And of those 3,000 transgender clients, we actually serving 3,300 transgender women at the clinic. So you can see that we had high HIV testing uptake among the transgender women on your left-hand side, which was 95% of the HIV testing uptake. We also seeing the 10% of those who receive testing, who received HIV testing, they were tested HIV positive. And of those who were tested positive, 94% of them, they were successfully initiated ART, even on the same day of the diagnosis and from our referral to their registered hospital. And we also found that 33% of them, they were virally suppressed at the month 6 of the ART initiation. At the below column, you can see that the syphilis testing uptake is also high. It was around 73%. We also found high syphilis reactive result among the transgender women clients as well. And among the transgender women clients, we found that around 33% of them have undergone genital surgery, which means that they have neo-vagina. And from a study that we conducted at the Tangerine Clinic and an HPV study, we found that 20% of them, of the transgender women who have undergone genital surgery, they carry oncogenic HPV types in neo-vagina. However, it's very challenging for us to increase PrEP uptake among the transgender women. You can see on this slide that 13% of the transgender women, they receive PrEP, while another 13% of them, they also receive post-exposure prophylaxis at the Tangerine Clinic. And on your right-hand side, we actually compare the data between transgender women who receive hormone-related services and those who did not. We found that those who receive hormone-related services, they were more likely to come back to the clinic. They were more likely to receive repeat HIV testing, to have repeat syphilis testing, and most importantly, they were more likely to receive PrEP when comparing with those who did not receive hormone-related services. So we proving that gender-affirming hormone treatment is another key to bring them to come to use the services and to retain them into care among the transgender women. And here are the data on the demographic characteristic and risk behavior of the transgender women at the Tangerine Clinic. We found that the median age among the trans women using the services at the clinic was around 26 years old. 50% 54% of them, they have below bachelor's degree education level. Almost 30% they were unemployed, and 16% they reported engaging in sex work. Almost 10% they're using amphetamine type stimulants. 55% they reported using alcohol, and almost 60% they had depressive symptoms. We also using the PHQ-9 to screen the depression among the transgender women clients at the clinic. And you might be wondering, how about the transgender men? We also serving the transgender men populations. However, we have very low proportion of the transgender men clients using the services at the Tangerine Clinic, which is around 6% of the total transgender populations at the clinic. However, the HIV testing uptake among transgender men is very high. We had 95% of the transgender men receive HIV testing, and none of them they was tested HIV positive. It's similar to the syphilis testing. We only found only one of them. He was tested syphilis reactive as well. And the primary focus or the primary intention of visiting the Tangerine Clinic among transgender men was gender-affirming hormone treatment. And when we're looking deeper about the data on transgender men, why they had very low HIV prevalence among this population, we found that 83% of transgender men at the clinic, they reported having sex with cisgender women. Wow, it's very interesting to know that 10% of them, they reported having sex with cisgender men, and 5% reported having sex with transgender women. So, however, it's showing that the Tangerine Clinic is still not able to reach the vulnerable transgender men who are maybe vulnerable or marginalized to the HIV acquisition. So this is our one of our challenges that we want to improve our work to reach to the most marginalized transgender men communities in Bangkok. And this data shows you about the sexual and gender-based violence among the transgender clients in general at the Tangerine Clinic at baseline visit. We found that 24% of them, they were bullied by their classmates, and the average age was around when they were 13 years old. 11% they were physically abused, and mostly by strangers and by their neighbors. 8% they were coerced into sex, and it was occurred mostly by their colleagues and by their siblings. Almost 0.5% they felt rejected due to their gender identity, especially when they apply for a job. And 16% they experienced public shame due to their gender identity. So you might be asking about how the Tangerine Clinic reaching to the population, to these transgender populations. So our Tangerine Clinic, we do not conduct traditional or conventional outreach. We don't go to bar, to sauna, or to hotspot, or to the physical communities. We actually using primarily online outreach strategy, and it's only our Tangerine Facebook page. We actually generate health demands among the transgender communities through our online platform. We normally organize once or twice a year, once or twice a month to organize the live session. We invite healthcare providers and transgender social media influencers to come and talk about transgender health issues. So the topics of the Facebook live session can be various based on the needs of the populations. So it can be transgender health, hormone, surgery, HIV, PrEP, and even post-operative care. So in this picture, you can see that we bring in the healthcare providers and transgender social media influencers, and we conduct Facebook Live in the picture. And here are the example of the transgender social media influencer that we are closely working with them. So they represent diverse background of the transgender communities, ranging from transgender sex worker, transgender youth, transgender celebrities who are the popular opinion leaders among the transgender communities in the country. So we call them Friends of the Tangerine. We actually invited them to come to use the services at the clinic, and they will be helping us to promote promote the services at the Tangerine. They conduct Facebook Live, how the clinics looks like, how the staff are very gender sensitive, and how the service is very affordable and accessible. So it's very successful that we utilize the transgender social media influencer in the past 3 years. So this data show you that how the performance of the transgender women client were reached by the transgender social media influencer. We found on the blue bar charts that almost 70% of the transgender women, they were actually reached by the Facebook page, which is our main online platform. And we can see that of 95% of those received HIV testing, and 35% of those who received HIV testing, they were HIV first-time tester, which they have never been tested in their lifetime. We also, it's very interesting to see that the HIV prevalence, the HIV positive yield was around 6%. We also found a high syphilis reactive rate, which was almost 10%. However, it's very challenging, as I previously mentioned, about the PrEP uptake among this population. So those who were reached online, we are able to reach to provide PrEP to 13% of those who were tested HIV negative. So and those who were tested syphilis, those who were tested positive in HIV, we successfully linked them into care, which is 95% of them. So it means that reaching them to the online platform is very key when we're reaching to these transgender communities in Thailand. So my next slide will be focusing on pre-exposure prophylaxis among the transgender women. So right now at the Tangerine Clinic, we actually have 2 schemes of providing PrEP to the transgender women. So the first scheme is transgender clients have to pay for the services if they are able or if they can afford for the services. The PrEP service fee is about $10, which is including lab costs and PrEP drug as well for the transgender clients who are visiting the Tangerine Clinic. And for those who are vulnerable to HIV acquisition and cannot pay for the services, we will be able to offer PrEP at no cost by using the funding from Her Royal Highness Princess Somsawari Fund to support the PrEP drug for this population. So you can see that almost 70% of the transgender women who receive PrEP at the Tangerine Clinic, they came from the PrEP services at no cost or have been supported by the Princess Somsawari Fund. And it's very challenging for us when we wanted to increase PrEP uptake among these transgender women populations in Thailand. And this data show you about the reason for declining PrEP among the transgender women. The data was not limited from the Tangerine Clinic, but we also gather the data from other community-based organizations across the country. We found that for those who were tested HIV negative, and we identified them that they have risk behavior, 63 of them were identified at risk, and 93% of them among those who were at risk, we were able to offer them PrEP. However, we found that only 43% of them, they successfully accepted PrEP. So we still are unable to offer PrEP to about more than half of the transgender women who were at risk. So when we're looking at the reason behind when they did not want to get PrEP, we found that 42% of them, they consider themselves that they were not at risk. And 28% they said that they did not like taking pills, and there's many reasons behind a PrEP not accepting PrEP, is including they wanted to use condoms only, they were not ready or they were not interested in taking PrEP, and the rest they might be fear of or experience the side effect, and they might be experienced from stigma and discrimination around PrEP drugs as well. And when we're looking deeper about the risk misperception among the transgender women, we found that the reason number one on your left-hand side, when they said that they were not at risk, we actually found that almost half of them, they're actually having condomless sex, which is 46% or almost 50%, and another proportion which was around 16%. We found that they reported multiple sexual partners, and the rest they reported they're engaging into sex work, and they ever having STI history. And the reason number 2 and number 3 share the similar risk misperception as the reason number 1. And it also comes to the PrEP retention among the transgender women. This slide shows you that poor PrEP retention among these transgender women population. On your left-hand side, you can see that those who are younger than 20 years old, they were more likely to have poorer PrEP retention when comparing with those who are above 20 and those who are above 25 years old. So we are thinking as the PrEP task force in Thailand that we should do something to address the low PrEP uptake among the transgender women population. In Thailand, we never have the transgender specific PrEP campaign for transgender women before, and most of the PrEP campaign only targeting to gay men and other men who have sex with men. So we actually gathered the data from the transgender women in the country, and we came up with the idea of launching the first transgender PrEP specific campaign. We're going to call this campaign as PrEP in the City. We will be featuring 4 different characters of the transgender women in the country who represent diverse background of the transgender populations in the country. And we actually learned this actually from the EPIC New South Wales project, that they are able to increase the coverage for PrEP among the gay men and other men who have sex with men in New South Wales. And I think this is something that we want to replicate the model from your country. And in September next month, in mid of the September, we're planning to launch the campaign. And this is one of the mock-up materials that we're planning to distribute and disseminate widely in Bangkok metropolitan area. This collaboration will be made possible by the Ministry of Public Health, USAID, PEPFAR, and Bangkok Metropolitan Administration, and IHRI as well. So I think we will see the impact of the campaign launch right after we distribute, officially launch the campaign for the transgender specific campaign in the next few months. And so during the COVID-19, we found that self-sampling collection is very new method used for STI screening. Is not only for transgender women, but for other general and key populations as well. However, we still see the need to continue sexual health services while maintaining social distancing and occupational safety among healthcare providers at the Tangerine Clinic. So we rapidly integrated self-sampling collection for chlamydia and gonorrhea testing for the first time among transgender women at the Tangerine Clinic. And we also expand these services to MSM population and other key population-led health services in Thailand as well. So self-sampling was actually collected at different compartments, including urine, anal, oropharynx, and neovagina for those who have undergone genital surgery. So in this slide show you the number from March to May when we rapidly integrated self-sampling collection for gonorrhea and chlamydia. We have around 131 men of sex with men and 56 transgender women conducted self-sampling collection. We have seen very high acceptability, varies by anatomical sites. We have 100% acceptability for urine collection, rectum, and neovagina, and we also saw the around 78% they accepted self-collection to oropharynx, and so far there was no invalid testing result. It's very interesting to know that the tested positive yield for chlamydia and gonorrhea by self-collection was very high among both MSM and transgender women population. In terms of the demographic characteristic and risk behavior among those MSM and trans women who self-sampling who conducted self-sampling collection, we found that it's very interesting to see that 63% of them, they were on PrEP, and almost 15% of them, they engaged in sex work, 10% they're using injecting substances, and 8% they had condomless sex. And we also found very interesting data that 30% of them who conducted self-sampling for chlamydia and gonorrhea, they were tested syphilis reactive as well. So in the past 3 years, we received interest and attention from many parts of the region, and also even in countries, organizations to come. They wanted to come and visit the Tangerine Clinic and to learn from our model. So 2 years ago, we successfully established a regional technical assistant platform on transgender health and HIV, and we call them as the Tangerine Academy. So it's actually the technical assistant platform for development and sharing of tools and learning resources to support further rollout of the HIV and health services model for transgender populations. So we actually divide the Tangerine Academy into 3 components. So the first one is apprenticeship training, where community health worker, healthcare professional can come to learn with us. It's actually requires 1 to 3 weeks for you to come and to learn from the Tangerine Clinic based from the real practices that we are doing and serving the transgender client at the Tangerine Clinic. And we also collaborate with the Center of Excellence in Transgender Health, which is endorsed the curriculum under the Faculty of Medicine by the Chulalongkorn University Hospital. So this is the example of the apprenticeship training where the community health worker, transgender populations and healthcare professional can come and learn from real life experience at the Tangerine Clinic. And we also offer the on-site technical assistance to other countries in the region as well. And in this picture, we conducted the on-site technical assistance in Vietnam, both in Ho Chi Minh and in Hanoi. City that we offer them to how to the technical assistance on how to conduct the training for healthcare providers and how to set up a clinic that providing the health services for transgender people in both cities in Vietnam. And here are the lessons learned from the 5-year implementation of the Tangerine Clinic that I wanted to share with you. I think the most important element that I previously mentioned is about we found that transgender community-led and community-owned response is key in achieving the HIV response and in delivering the HIV service and programming in the country. And we also found that integrating gender-affirming hormone services into the sexual health services for transgender women is very successful in achieving the HIV response as well. And we also found that gender-sensitive and well-trained staff for the transgender health clinic is also important element to serve to the transgender population. And the Tangerine Clinic actually organized once or twice a year knowledge sharing platform between transgender communities and healthcare professionals. They can come to learn and sharing their experiences, their concern, their needs, and among each other, so that we can improve our service quality in the long run. And we also engage transgender who living with HIV and into the healthcare team as well, so that they can provide psychosocial support to those who are in need when they tested HIV positive. And our services is actually affordable fee-based services. So when the donor is transitioning out of the country, we will be able to sustain our service provision to our transgender communities in the future. And I want to emphasize that the first step of providing transgender specific care is to reduce or to eradicate the transphobia in healthcare setting. And I would like to acknowledge the contribution from my leadership, especially Professor Prapan and Dr. Nitaya and my team members to the success of the Tangerine Clinic in the past 5 years of the implementation. And thank you very much for your attention. Thank you. That's the end of my slide. Thank you.
Thank you, Rena. That's for that really inspiring presentation. I think it's amazing to hear of such a large clinic based in growing out of the Thai Red Cross Centre and now the Institute the IHRI. We do have some questions there, and we do have about 15 minutes for questions. So if you're in the audience out there and have a burning question, do write it down now. It's not too late to answer the question. To start off with, Rena, I'm really interested in this issue of how we address stigma for key populations, and it's a global issue, and involves all the different key populations. And you mentioned that evidence about the existing experiences of stigma within the standard healthcare setting, and then of course your response was to build this key population-led services. But what's your view about the balance between specific services like key population-led services versus educating mainstream services to be more positive in dealing with key populations? Where do you think the right balance lies?
Yes, thank you very much, Andrew, for the question. I think we are trying to achieve both way. In terms of mainstream public health facility, we are also working with the public hospital to integrate or introduce the transgender competent healthcare services into the mainstream services to their service provision. And we also trying to advocate with the medical professional and other university hospital to introduce or to integrate the transgender competent healthcare services into the teaching curriculum. And on the other way, we're trying we have to admit that lots of transgender people, they don't normally go to the mainstream or public healthcare facility, and we are trying to invest to the key population-led health services clinic where the transgender population they're mostly living with, especially the key population health services actually expanding to the cities or to the communities where the transgender people living in, for example, Pattaya, where the transgender sex worker living, and they normally don't go to the public healthcare hospital, for example. But I think I see your point that to promote the sustainability and to ensure the stigma-free environment at the public healthcare facility is also important, and is other strategy that we are trying to address.
Thanks, Rena. Yeah, and I think we share a lot of the same issues that you had. I think you gave a really nice explanation for how you're struggling about how to contact transgender men who might be at high risk to the same degree. And I know, for example, in our gay community-led services, we're really struggling to get some of the sub-communities of gay men. So, for example, Chinese-born gay men or Indian-born gay men, and when you get to the communities within communities, it's quite difficult at times. Okay, I might move on to some of the audience questions now, Rena, and one of them relates to from Catherine O'Connor, relates to the differences in the expression of transgender issues around Asia and the Pacific. Do you think that the lessons you've learned in Thailand are also applicable around Asia and the Pacific, where there may be different expressions of transgender identity, or how much of this is a purely local issue? Rena, you're on mute.
In terms of translating the model into other countries and other contexts, I think it needs to, of course, it needs to adapt to be more culturally appropriate for that settings. When we went to Nepal, our transgender health team went to Nepal before the COVID-19 outbreak. We also learned that the differences between culture and society in among the transgender population between these two countries as well. But however, I think we have the basic principle of the transgender-led and community-owned response. I think this can be translated into the other context as well. So I think we right now we are trying to expand the model into 3 countries, for example, in Nepal, in Myanmar, and in the Philippines. So I think, but we ask them to adapt our practices into their own context with our technical assistant. So I think it can be translated into different contexts, and also in the Pacific Island countries as well, which I think is very, very different with the Asian countries like Thailand.
Thanks, Rena. And I know it's absolutely an issue that UNAIDS are pushing very hard, this fact that where there is stigma and discrimination, key population-led services are usually the most effective ways to deal with issues of HIV prevention. And I think you could argue of healthcare more generally, really. I'll just move on to another question now. This one is about same-day antiretroviral therapy from Philip Keane. He's just interested in your experience in Bangkok regarding uptake among people diagnosed that day. Do people accept that offer, and are there barriers you've had to overcome? This is just to let you know, this is coming from a place that this is a big issue for us here. We still don't have same-day start very commonly. We do some of it, but we're wondering whether we should be doing it more.
I think I can see the differences before we started same-day ART. We just started same-day ART 3 years ago, but before that, the first 2 years of the clinic set up, we had only 85% of the ART initiation rate among the transgender women who were living with HIV at that time. However, when we introduced, we have another team to develop the same-day ART, and when they introduced this service to the Tangerine Clinic, we found that the ART initiation rate was improved to 95%. So we found that the organization, so I think we actually found the barriers as well, especially when we found that many transgender women and other MSM, they did not have their health scheme registered in Bangkok, because most of them, they come to Bangkok to seek for employment, and they were tested positive at our clinic. We will be able to assist them to transfer their health scheme from their home country into Bangkok, so that it requires 2 weeks for them to actually initiate ART. However, at the Tangerine Clinic and anonymous Thai Red Cross Clinic, we will be able to subsidize the ART for them within 2 weeks' time. So I think we can subsidize free ART, which we use from our own fund to support the patient within 2 weeks. And after 2 weeks, we will be successfully register them into the registered hospital. One of the strategies that we found is very successful from our same-day ART program is that we have the transgender navigator, because they will help them to provide the counseling, to accompany or escort them to the registered health scheme, to ensure the soft launch, to ensure the soft hand transfer to the healthcare provider at the registered hospital. Many transgender clients, they say, oh, they did not want to go to their registered hospital because of the stigma and discrimination. But before that, we went to those hospitals to ensure that we will be refer our clients to your hospital. But we already initiated ART for them for 2 weeks already. You have to offer them or to continue the ART for them, no matter what. So I think this is kind of ensure that we can our transgender patient can access to these services. And one of the elements that we found successful is Transgender Navigator contributes to this success.
Great, thanks, Rena. There are another couple of questions here. A couple of people want to know, how did you pick the name Tangerine for the clinic?
So actually, the name of the Tangerine Clinic came from Dr. Fritz van Grijnsven, who developed the guideline for our clinic. But when it came to the community consultation, we actually nominated Tangerine as one of the options, and transgender community came up with many names, and they discussed a lot and they argue a lot, but finally we came to the consensus that Tangerine was the most appropriate option. And as we did not want to stigmatize this clinic as a transgender health clinic, because we know that many transgender people, they did not want to disclose their transgender identity, and the Tangerine is kind of playing the terms as transgender. but we did not spell out loud that this is transgender clinic, and it's the name of it's not too feminine, it's not too masculine for transgender men or transgender women, so it's quite gender neutral. So we finally came up with the Tangerine. Yes, and I liked it.
Yeah, I think I'm quite familiar with the concept of, when you're dealing with a stigmatized community, you don't have a name and a front that is too out there. I know in Australia, for example, sexual health clinics, traditionally, the name of the clinic has been their address, because they don't want to say we're a sexual health clinic to people on the street. And even in Sydney with the gay community-led HIV testing services, it's like a test. It's not, gay men's testing service. So I think stigma plays a role in this. There are another couple of people, Rena, who are interested, I think, in the relatively low level of PrEP uptake and then PrEP continuation in the data that you presented. Do you have any ideas of what the barriers to accessing, and then, well, they get access through you guys, but then what are the barriers to continuing use among your population?
Yes, I think one of the barriers is about the messages that we're trying to tie PrEP with the risky behaviors. So we found that many transgender women, especially those who know about PrEP, they will be automatically stigmatized by when they were offered PrEP. However, our upcoming campaign that we plan to launch, we're trying to promote the gain framing messages around PrEP as one of the option that can help you living healthy and free from HIV, because we learned from the MSM PrEP campaign in Thailand that is always related to risky behavior, to condomless sex, and it was also judged by the wider public community. So I think we trying to encourage the public messages around PrEP, not to be stigmatizing those who taking PrEP. And one of the lessons learned that we know that we encourage right now transgender people to have daily PrEP right now, because of we afraid about the drug interaction, especially those who are on hormone. However, we found that it's very difficult and it's challenging for them to take daily PrEP. So we're trying to think another strategy to come up with the effective use of PrEP as well. So it's not only limited to transgender people, but it's also about among MSM communities as well. So this is another strategy that we will be introducing in the next few months, and we will see whether or not the PrEP uptake among this population will be increased.
Yes, Rena, I know, and also here in Australia, we're moving away from talking about high risk and low risk, and painting PrEP as more just a responsible decision that people take to protect themselves. And do you think the availability of injectable PrEP might make it more acceptable in your setting?
I'm sorry?
Do you think the availability in the future of injectable PrEP might make it more acceptable?
Yes, as we are one of the HPTNO83 sites, and we are the site that we can enroll most of the transgender women participants and into this study, and we found that if we have the injectable PrEP, I think it will be able to increase the PrEP uptake among these transgender populations. Because one of the reason when they learn that they have to take daily PrEP, or they have to come to our clinic very often, we thought that we may need to think about another option. So injectable PrEP may be another convincing option for the transgender women populations. Even myself, I'm interested in learning more about injectable PrEP in the future.
Okay, I think time for just one last question. I'm not absolutely sure what this question's trying to get at, and see if it means something to you. There's a question here about what do you think would be the role of peer support groups in demedicalizing gender-affirming hormone therapy?
Yes, I think our transgender counselors have the important role to demedicalize gender-affirming hormone treatment. And it's not only specific to gender-affirming hormone treatment. Our trained transgender counselor can share their direct experience of using unregulated hormone in the past and are able to convince or to change the behavior of using unregulated hormones or hormones from the black market and to change the behavior of them to come to use the recommended hormones. So I think we are very successful by having our transgender personnel team to have direct message, to talk in the same language when we want to demedicalize the gender-affirming hormone treatment. It's not only about the gender-affirming hormone treatment, as I said, it's about PrEP, it's about HIV testing, it's about neo-vagina care, for example. I think it's very, very key for the peer counselor to play this role.
Right. Okay, well, unfortunately, our time is up now, Rena. But I really wanted to finish off by thanking you so much for giving us an inspiration in what you've done there in Bangkok. You know, over the last 20+ years, our organisations have worked close together, and we've learned from each other over the time. And I think this is an area where we can learn a lot from what you've done. So thank you very much for agreeing to speak to us today, and we look forward to working with you in the future.
Yes, thank you very much, and hope you are well and healthy. Thank you very much for your attention. Bye-bye.
Thank you, Rena, and goodbye, everybody. Bye.
Bye.
Bye.